It's not exactly accurate, but it's not a substance in your blood. It's not anything else. It's just this big long.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of Kidney Coach and Kygenesis, and I'm joined again today by the amazing Jessianna Seville, who is the founder and primary practitioner at Kidney Nutritional Institute. I'm going to hand it straight across to you let's get into it. Let's talk all things diagnostic tests when it comes to chronic kidney disease.
So let's talk about getting a diagnosis of kidney disease in the current medical environment. What does that look like? Now, there's actually, 6 areas that a diagnosis can come from. One is the urine, one is the serum, another is the genetics, another is the biopsy. And I feel like I'm missing one more in there. Nope, that's it. Those are the main ones. So I guess there's 4. All of these can play in different ways to a diagnosis. The most talked about, debated, and controversial marker in kidney disease is the GFR.
Yeah.
That's the Glomerular Filtration Rate. Generally, for the sake of simplicity, clinicians will say that the GFR equals the percent of your kidney function. So they'll say if your GFR is 60, it means that you have 60% of your kidney function.
Mm-hmm.
It's not exactly accurate, but it at least creates a visual for people of what's going on with their kidneys. GFR has a lot of problems with it, but it is what is used in research, and there's like 3 or 4 different formulas. It's really just a formula. It's not a substance in your blood. It's not anything else. It's just this big long formula that the numbers are plugged into: your creatinine, your age.
Yeah.
And they plug those numbers in, and then out shoots this percentage of kidney function. So it's a mathematical formula. And there's 3 or 4 different mathematical formulas that are debated about, but that's neither here nor there. What's important for patients is that with a GFR number, it's a trending number to watch. One number for me in and of itself is kind of like, I kind of have a ballpark about where someone's at, but it doesn't matter to me therapeutically on treatment until I see what the trend is that's going on. And I'll give a good example of that in a second. GFR will often be used to determine your stage of kidney disease. So if you're stage 5, then you're 15 or below. And I hope I get all these numbers right. I'm doing them off the top of my head.
Oh,
if you're
right.
stage
15 below,
yeah, stage 4, you're, I think, 16 to 30. Or 29. If you're 3B, there's 3A and 3B. So if you're stage 3B, then you're going to be about 30 to, I think, 39. And stage 3A, I think, is 40 to about 50. And then you, maybe it's 60. Now I'm forgetting a little bit.
Got it
somewhere
right.
there.
Yeah.
We'll look it up quick and drop it in here. And then just stage 2 up and above.
60, yeah.
So GFR gets talked about a lot by clinicians. And so that's where patients obviously are going to focus on. And it's where, visually you think like, oh, that's my percentage of kidney function. So like this has to be the thing I follow to know if I'm getting better or worse.
Mm-hmm.
And it can for sure show that people are getting better, and it can show that people are getting worse, but it's not really actually that precise.
I think that's a great point to nail home, and especially if you're having a reading every 3 months and you're a bit dehydrated beforehand, or they use a slightly different formula. And even if you've gone down just 1 or 2 points, people can get quite disparative about that. But like you're saying, it's a big deal for a small mathematical formula that everybody puts everything on. So I think that's a really good point of what you're saying.
Yeah.
If you want to know more about what we do, head to kidneycoach.com, and we're on all your social media platforms, whatever the social media platform is, /Kidney Coach. You'll generally find us. Make sure you hit subscribe and like, so this helps our little YouTube algorithms, and that means you'll get notified anytime we put up new videos. Jess, thanks again. I really appreciate you, and we'll talk to you all next time. Bye.
Bye-bye.